Hi,
Hi, how are
hi.
you, Divya?
I'm good. How are you?
I am good. Tell me.
Yeah, thank you so much for joining today. So I was just telling everybody that today we have the honor of having Padma Shri Dr. Manjula here with us, and we'll be talking about COVID vaccines and also a little bit about the second wave of Corona.
Right.
Um, so we are just being joined by a few people, and I'll get started. Um,
Right?
Okay. So I think my first question was about the second wave of Corona. I mean, why is it like so different than the first wave and why it's like affecting so much?
Right. Let me tell you a few things about virus. Virus is something which always want to survive. It is a survival of the fittest. All of us want to survive. So when last time it thought that people were becoming more powerful and it wanted to become more powerful. So it changed its structure. It's changed its architecture. So it mutated. So the new virus which has come is more virulent. The spreading rate is very, very high. The multiplication rate is very, very high. And the way it responds to medication is also less. So when it has happened like that, and unfortunately or fortunately, we had vaccinated above 45 years. So they started doing better because their body, the antibodies which were produced inside the body were giving cross protection to this particular virus, and they were surviving. The younger people who have not been vaccinated did not do well, and they are the people who have started becoming more morbid and more mortality. More people were dying and going on to ventilator. So this wave is bad because of ourselves, which we were negligent also, because we thought we conquered COVID. So we became Abail Mujhe Maar. So we were going around
Yeah.
and running around. And now stay home, stay safe is still not done. Masks are still not there. Political rallies happened. Religious rallies happened. So it is both the fault of ours plus the virus which has become more powerful. So
Mm-hmm.
we both learn how to keep it under control by doing primary prevention, that is vaccination. The secondary prevention is the treatment. Means the prevention is again the mask, social distancing, and the antiseptics which we have been using, plus the treatment which the doctors tell us to take by increasing our immunity boosters. And when the corona comes, instead of delaying, going
Yeah.
immediately, detecting and treating.
Mm-hmm. So it is just, I mean, so it's mostly because like the older people were already kind of getting vaccinated, so they had a
Right?
little bit of protection, unlike
Yeah.
the younger people. Okay. So, it's causing a lot of serious illness in the young people and the children also. And of course,
Right.
parents are worried about children because they cannot wear masks and they cannot get vaccinated right now. So, what is, in your opinion, the best way for those parents to take care, especially the newborns and infants?
Yeah. The best way is they put on the mask. See, we always say that at least one person, if we put the mask, that is a viral load which has to be less. Even if the kid gets it, if the load is less, the body's immunity will fight against it and save the kid. So if we wear the mask, we can prevent the kid from getting it by 50% at least. So if the two persons wear mask, it is even drastically going to come down. So if a kid, not the baby, but the kid can learn how to put on the mask, and the etiquette is something, the cough etiquette is something which has to be disciplined in everybody who is there, that can go a long way. So staying home, stay safe, doing online schools and keeping the mask on. Now we know it is airborne. So being all these way careful is something which we can help.
Okay, so now, yeah, go ahead.
Immunity booster, keep the supplements.
Yeah.
Please give the vitamins, multivitamins, good food. When we say good food, it is the vegetables and the green leafy vegetables, egg, chicken, fish, omega-3 fatty acids, all the supplements which we can give.
Mm-hmm. So, because you also mentioned that it's airborne, and some people are actually getting confused in the definition of airborne, because some people think that if they go out in the balcony and they like stand there, they'll get the virus. But actually, that is not really true. So, if you can explain a little bit, but difference between the droplet and the airborne transmission, yeah.
Droplet is when we sneeze or something, when the infection is entangled by a drop around it, and when it falls somewhere, that's when the infection comes. This is what we thought before. So that's why the surfaces and all were the thing. But the latest Lancet has said that no, it is airborne around the person who has COVID. So just because we are standing in balcony, no. Fresh air, no. But around the person who has COVID and he has been spreading the virus, that's where in the air it will be there. So if we wear the mask, we are preventing that air from coming into the thing, and the mask will prevent from the air into coming into our nose and the mouth. So when we are preferring, it's a 3-layer mask is what we look at, or even N95 mask is what we are looking at. And 6 feet is
So
quite enough distance. 6 feet is good enough distance.
yeah. So, with the newborns and everything, like with the moms, I received a lot of questions from moms who said that they want to breastfeed, but now their baby also has corona. So, in those kind of situation, like, what do you recommend?
Please breastfeed. Even baby has corona, whether you have corona, please continue giving breastfeed. WHO recommends breastfeeding. The reason being that all you mothers out there, remember, you're going to give immunity to your baby by breastfeeding. The immunoglobulins and the antibodies which your body passes to the baby is a great save for the baby from getting corona. And the babies also receive the protein, antibodies, vitamins, iron, everything from you. So you are the one who is going to protect the baby through the milk. So continue breastfeeding. Don't stop.
So if the newborns or the infants, they get corona, is it like very serious in them, or is it still considered to be a mild?
Usually mild, because what happens is our immune response is very, very high. So what happens, what we call it as cytokine storm, means in the olden movies we used to see, हम लोग एक चाकू लेके we play this word, the lancet game. When we do, there will be sparks which come. So when the body's immunity comes out in a severe form and fight against the virus, there will be sparks which come. That is called cytokine storm. That causes more damage. Whereas in babies, the immunological response is not so high. So cytokine storm is not so high. So the disease is going to be mild in them. So don't worry. But you have to show to the doctor, take the supplements, and treat the babies.
Okay. So just for my curiosity, I'm asking, is the mortality rate amongst the newborns and infants, is it high this time with this? Okay.
No,
Good.
only thing, infectivity is high. So we are finding the numbers high. So we are finding it. That's it.
Okay. So then actually just coming down to the vaccines, if you can, tell the difference between Covaxin, Covishield, and the Sputnik 5.
Right. See, what everybody gets confused is, did we have time? Only 1 year? No. It is like if you have a coffee cafe day in one place and you're starting a coffee cafe day in another place, is it new? No, it's only replicating. The same way, the vaccines which have been used from last century, that is the polio, flu vaccine, all these vaccines, the same technique is utilized to produce these vaccines. We are replicating by changing the flu virus with coronavirus. That's it. Or Ebola virus with coronavirus. See, virus protein. So Covaxin is the attenuated virus like flu vaccine, polio virus, and the Japanese encephalitis virus vaccine. Okay. So we just have a no live virus there. It is just killed or attenuated vaccine. Whereas when it comes to Covishield, it is a vector vaccine. Means we are piggybacking on the adenovirus, chimpanzee adenovirus, and putting the viral protein, spike protein on it, which is detrimental for us. So we are giving that protein, so that creates the antibodies in our body. In Sputnik, you have 2 adenoviruses on which we are piggybacking. So the purpose is, all these, when they're given to us, the body responds thinking it is virus, it's a foreign body, and antibodies are produced. These antibodies becomes like memory cells. These antibodies will be there, and when next time when a virus comes or the second injection is given, the memory cells act and more antibodies are produced, and if it is real virus, these antibodies goes and kills them. So it is saving us. It is active immunization. That is what we need to understand.
So I actually went to the website of Covaxin and I looked at their technical, the sheet that they have, and they mention that they don't advise Covaxin for the pregnant and breastfeeding women. However, there has been those statements.
Yes, this is the point I have to tell you. Any medicine which comes, Divya, any medicine which comes, they will always say this is as of now not, because they're never tested on pregnant and breastfeeding women, because nobody wants to take the risk. But what we know till now, the facts is that pregnancy is a stage of clotting time when the high clotting tendencies will be there. The mortality and morbidity of corona in pregnancy is 20 times much more higher. So it is the most detrimental time when very susceptible age group. So government as of today did not give any guideline for that, but the recommendations from all the obstetricians and gynecologists who actually treat these patients is that it is more detrimental if a pregnant woman gets this virus. So please, 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 all of you out there, save yourself. Go and take the vaccine. Vaccine is harmless. COVID is harmful. And if a pregnant woman gets COVID, it's 20 times more riskier that they go into any risk of blood clot or death also, or going into ventilator. These are the facts. Data is very limited, but facts are very, very clear. So don't worry. This is an off-label use as of today. Hoping that government will give us the on-label use. Just like how the flu virus is now mandatory to give in pregnancy. TT, mandatory to give in pregnancy. TDAP, mandatory to give in pregnancy. Over years, that recommendations will come. But fact is now that corona is more deadlier, vaccine is safer. And pregnant woman plus corona is a double dhamaka bad combination. Just go and take it. So I hope I answered.
No, you definitely did answer, and I understood. One mom actually messaged me saying that she wanted to take the vaccine. She's breastfeeding. She wants to take the vaccine. She went, but the gynecologist said no to her. So
that's because nobody wants to take the risk. I would say maybe again between the lines, quote unquote, just go and take. You don't have to announce everything. They would ask, but you want to save yourself first. That is a human right. That's your priority to survive. Like I said, survival of fittest. Just go and get yourself vaccinated.
So I'll just answer, ask you a few of the questions that people have been asking. So one question is, what if I get fever during pregnancy because of the vaccine? Will it affect my fetus?
No, fever itself as such will have a higher negative effect in the pregnancy. So fever to any viral infection can have 5 times more risk of any abortion or abnormalities in the first organogenesis period. So we don't want you to have the fever. The temperature should not increase. So hydrate yourself very, very much after you take the vaccine. And if necessary, take a Dolo 650 or a paracetamol. So see that fever does not rise. And with Covaxin, usually we do not see any fever also. With Covishield, because your body is developing some amount of antibodies against it. But saying that both are very safe in pregnancy, and saying that I also know that AstraZeneca COVID is very much tested in UK and RCOG recommends it. So just don't waste your time waiting for any vaccine. Just go and take whichever vaccine you have it available.
Okay. So one person is asking, what is the ideal time in pregnancy to take the vaccine?
See, ideal is as of today in the pandemic, every day is ideal. But if it was not a pandemic, I would have suggested after 12 weeks of pregnancy. Okay. If it was not a pandemic. But today, in this today's time, today is the ideal time. That's it.
Yeah. Okay. So one question, basically, I know that it's actually allowed and recommended to take the vaccine if you're trying to conceive. So what happens if you become pregnant after your first dose of vaccine? Then
absolutely nothing to worry.
Nothing to worry.
Nothing to worry, and finish your second dose after 4 weeks.
So I think they have a question, after how many weeks of first dose should we take the second dose? I think that's dependent on the vaccine.
Yeah, minimum 4 to 6 weeks depending on the vaccine.
So there's also this question that after first dose, if you get COVID, I know the guidelines actually say that you should delay the second dose by 14 days.
4 weeks, right.
But there are a lot of other places where I've seen 1 month, 2 months, 3 months. So according to you, what is the best time frame that people
minimum time is 4 weeks.
Okay.
Usually maximum up to 3 months. So, but minimum time, don't take risk. See, like I said, when you take a second dose, your memory cells produces more antibodies. So you have an anamnestic reaction. So you want always the antibodies to be above the threshold level. So just go take it.
Okay. So they can just wait for 1 month minimum and 3 months maximum.
And then take it. Yes.
Okay. Now I'll just see this one question. I'm a new mom. My baby is 18 months. We recently conceived again. I'm 12 weeks pregnant and I want to get vaccinated, but my personal gynecologist is against.
I know the same thing. I would only say that you need to take this is a informed consent, and you please go and take it.
Okay. Then again, this person is asking what is meant by airborne. I think that there's like a lot of confusion about this.
Yes.
Yeah. I think, is there any use of clomiphene tablet?
Clomiphene. See, I saw the question. First thing is somebody asked, anovulation means can I not become pregnant? See, what is necessary for pregnancy is one egg and one sperm. If there is no egg, how will the pregnancy come? So ovulation is the essence of pregnancy. So clomiphene is a ovulation induction drug. So clomiphene is given for you to ovulate, and doctors do a follicular studies to check whether you're ovulating or not, and have a timed intercourse around the time of ovulation. Then the luteal phase support in the second half, and then the chances of you becoming pregnant is very high. So relax, don't allow that to affect you. Just go and meet your doctor. Your doctors will help you.
Okay. There's a question: how many days an asymptomatic patient should isolate in home and wait, and up to how many days they can again like take the COVID test, and can they take the vaccine?
After 14 days. That is what is important. Vaccine is after 4 weeks, but test after 14 days. Asymptomatic means your antibody levels will be little lesser, but your infection is there, and you can always spread the infection. So self-isolation for 14 days, repeat the test after 14 days. And after getting treated, wait for 4 weeks and go for the vaccine.
Okay. Somebody is asking, is it safe for breast cancer survivors to take the vaccine?
Yes. Any cancer, you're all at a risk of getting COVID and COVID complications, whether it is breast cancer or any other cancer or diabetes, heart disease or hypertension, liver disease or anything. Just go and take your vaccine.
Okay. Somebody is asking if they've already recovered from COVID, do they need to take the vaccine?
Yes, you need to take the vaccine, wait for a month and go and take the vaccine.
Okay. Actually, one question was, can people test positive after the vaccine?
Right? You can always get infected. This is not preventing the infection from coming. It is preventing the infection from killing you or allowing you to go into ventilator bed or ICU admission. This is an active immunization. Means it will produce antibodies in your body that if the COVID infection comes, these antibodies will go and fight with the COVID infection and cure you faster. So don't go and say hi, hello to people who are having COVID. Put your mask on, maintain social distancing. That is important to get not get the COVID. But the vaccine is to prevent you from having the side effects and the infection-induced morbidity and mortality.
So one question actually is, please ask my question above. I'm lactating mother of 1.5-year-old baby. Should I go for the vaccination? Yes.
You should.
Yeah. So actually one was, between the first and second dose, of course, like people are getting reinfected. So usually they say that it takes about like few weeks for the immunity to kick in after the first, after the second. Well, so would you recommend like to them to, follow all the, masking measures and everything? Yeah.
Even afterwards, even if you have vaccinated second time also, you should maintain all the protocols and the etiquettes.
Okay. So if somebody is done with the 17 days of isolation and in those days they just lose the sense of smell and taste, what about the RT-PCR test? Are they required?
See, sense of taste is gone means it is positive. Okay, so if your RT-PCR comes negative also, it is definitely corona positive. But we need to do, if your isolation of 14 days is over, then do the RT-PCR to know whether you have become negative or not. So that you can wait for another 4 weeks to take the vaccine.
Okay, so somebody actually asked, can I try for pregnancy parallelly while taking the vaccine?
Yes, you can try.
Somebody said, I have autoimmune disorder.
Please definitely go and take. Autoimmune disorder is very important. That shows that if at all you have this infection, your body response is not going to be the way it has to be and you will be succumbing to it. So autoimmune disorder, please go and take. If you're on steroids, which can be stopped for 2-3 days, stop it and go and take the vaccine.
So somebody is asking about the consent form or the letter that you were mentioning about.
Yes, you can always say it is my risk on which I'm taking the vaccine and your gynecologist do not have a role, and then take the vaccine because you need to take the vaccine to save yourself. You understand why you're taking it, and then I think the gynecologist can give, because as of now, government has not given the consent for it.
So somebody's asking, why do we need two vaccines, like two doses?
Like I said, the first dose you give, your body produces certain amount of antibodies, and it will always come back like a dumbbell. But we want a threshold level on which the antibodies in your body should be higher. The second dose causes an anamnestic reaction. What do I mean by that? The memory cells will start producing again the antibodies, and they go up and they stay above the threshold level. So now you have a antibody level which has gone up, come down. Then your second dose has come, and they're going to stay either high or it is going straight above the threshold level. Means they're always above it, and then they fight against the infection which comes. Now, when do they come down? We don't know. As of today, for 1 year, they are safe. After 1 year, when we test again, then we will know whether these antibodies are going to stay lifelong, like HPV vaccine or hepatitis B vaccine, or they're going to come down. So we have to give one more after 1 year. That is a booster doses. That is like flu vaccine.
Yeah.
So every vaccine acts differently. With flu, we give every year. With hepatitis B, we don't give every year. We take 3 doses and that's it for lifelong. Same way with HPV, lifelong. So with this, it might not be like lifelong because it is mutating itself. So it might be like flu. So as of today, 1 year. And after that, we might need it again.
So it's basically your natural T cell-mediated immunity to actually
Cell-mediated immunity.
And it will take time. And also, it's just because we don't have enough data right now on the vaccines. That is why we don't know how long, it'll.
Yeah, we have enough data about efficacy. We don't know data about how long it's going to be good, and what is this, the post-vaccination way, as what we call it as, that is safety record of date, and what those are the things which are being evaluated now. Not the efficacy. Efficacy is there. It's just the replication of the method.
Okay. 1 year baby, 5 months pregnant. Can she take it? Explain how asymptomatic COVID positive carry the virus.
You are asymptomatic, but you're COVID positive. It is very simple knowledge that you're having the virus. So virus is there to spread. So it will definitely spread. You are not having symptoms, means your antibody levels will be less. That means what we need to understand, you are not fit to give plasma to the other people. And it is also a possibility that you can always get back another infection. So please do not take it for granted. You are going to spread. You are going to be a symptomatic carrier. So isolate yourself and don't spread it.
So why does RT-PCR continue to be positive even after 14 days in some people?
It takes time for it to completely go. That means, like I said, your immunity is not good enough to fight against it completely, and it is not going. So take care for another 5 days to 6 days and then repeat it. It is not a rule. With science, 1 + 1 is not going to be 2. I always tell that, 1 + 1, if you're not using condom, is going to be 3. So you be careful. You better be careful with science. It's not going to be like math.
So how can we control the coronavirus through yoga and naturopathy?
Yoga and naturopathy is not to control. It is only to increase your flexibility, your breath, so that your lung compliance increases. Yeah, all those help you. Maybe it improves your positivity, so your immunity might help you. Okay, but it will not prevent the infection from coming. If it comes, you have to be treated. Vaccine is to prevent the body from succumbing. You do continue doing.
Yeah. So, ma'am, the person who is taking statins and BP tablets now before going to vaccination, should they stop, or they
don't have to stop? Please continue. You should be taking it. Even blood thinners, continue. You check your INR. That is the only thing. If you INR should be in the range of 2 to 2.5 if you're taking a Clexane, or 1.5 if you're on blood thinners, but continue taking them.
After vaccination, how many antibodies stay in the blood? And for how many?
Antibodies depends on how long this we usually want. We want it to be more than 1 in 160. This is the ideal thing. How long we really don't know. So that's the reason second dose is given, so that they stay above 1 in 160. Even 1 in 80 is good enough. Okay, don't worry. Just take the vaccine. That will prevent.
With pregnant, with diabetic, can they take the vaccine? Yes,
they can.
Is there COVID reoccurrence after 14 days of testing negative?
It can be a same infection which is already there, which is still lingering, which is positive. So it can be a recurrence. Also, if you are against going and talking to the other person who is having a different strain of COVID, so virus keeps mutating. So many strains are there. So don't keep going around. Maintain the protocols.
Mm-hmm. Does only fever of 102 not reducing with dolo warrant hospital admission?
Yes, definitely it warrants going to the hospital. Whether they need admission or not, the physician is going to tell you after giving simple treatment. Definitely fever which is not coming down, breathlessness which is increasing, pulse ox which is showing less than 89, 90, or even somebody who's now having orthopnea. All these things, you walk about 6 feet and you're getting breathless. All these things are very, very important for you to go to the hospital.
Mm-hmm.
Let them check, let them do the CT, and then if accordingly they will say how your lungs are, they need admission into ICU or regular room.
Okay. So does only fever of okay, this I asked. Having thyroid, can they take the vaccine? Yes.
They should.
Mm-hmm.
All comorbidities you should take.
So is there any, under any circumstance should they avoid?
One, if you have an allergy to that particular ingredients of that vaccine, avoid it and take the vaccine. But I think in pandemic, you should take the vaccine. There's no question of avoiding the vaccine. Like
And
I said, if as is on NSAIDs or you're alcoholic, where immunological response can be less, we would always say that wait for 2-3 days and take it. But you should take.
so, there are so many variants and everything going around, and of course, the virus is mutating. According to you, are the vaccines that are currently available, are they going to protect against those variants as well?
Definitely, cross protection is something we are looking at. All the spike proteins will not be changing in mutation also. And these things have shown cross protection because the way we are seeing the response of the patients who are admitted, who are vaccinated versus people who are not vaccinated, we know that cross protection is the one which is saving them.
Mm-hmm. So, even if the variants are going on, some of them might be actually more infectious than the other. But if, there's a vast majority of people who get vaccinated, especially the young people, there is a chance of, the cases going down then. Right?
Definitely. And looking at one thing, if you take epidemiologically, if you take this vaccine, by next year, another variant vaccine comes. Next year, another variant vaccine comes. So if all of us keep taking vaccines by being a responsible citizen, hopefully by 2025, we should be getting rid of this particular virus completely.
Mm-hmm. So even after, the second dose, I already asked you about the measures, like people should keep wearing the mask and everything.
Yes.
So one question might be actually, for how long?
How long? Till government or till we say that, okay, the complete virus is under control. In US, as of today, we have they have given a thing that you don't have to wear my mask because you are vaccinated. Hopefully, we will also see that day if everybody takes the vaccine. So our population is huge. Our dose of first vaccine is still not over. So maybe we'll hope for a day will come when all of us are vaccinated. Then we can also proudly say we have been vaccinated, so we don't have to wear it.
Okay. Does somebody require any medication for the loss of smell or taste, or should wait for naturally to come around?
You definitely need to consult either by video consult or something a COVID physician and start all the supplements which they give. Self isolate and keep checking your breathlessness, keep checking your pulse oximeter, and keep doing this, like I said, breathing exercises and walking. If you become breathless, if the fever comes back and it's not coming down, or if you have chest pain or anything like that, then definitely time for you to test and then go to the hospital.
Mm-hmm. Can you donate plasma if you're on antibiotics? And what is the titer of antibodies needed in a donor?
You can donate plasma if you're on antibiotics. And only thing is, if you're having infectious diseases, you cannot donate. If you're pregnant, have been pregnant, you cannot donate. These are few things which are anemic, you cannot donate. If you're having less than 50 kgs, you cannot donate. And the titers we are looking at is more than 1 in 160. Sometimes, if necessary, 1 in 80 also we do take plasma. That is a passive immunity. Vaccination is an active immunity, and immediately in the first week, 3 to 7 days, we want to protect somebody, we give plasma, because if there is if the CRP is more than 50 and your infectivity viral load is high, then plasma is the one which will give you the passive immunity and it will save you.
Mm-hmm. After vaccination, antibodies are depending on the immune response. Everyone has different immune response. Does everyone get antibodies if they take the vaccine?
Some amount of reaction will definitely be there, which your body will produce. That is the reason second dose is given, so that hoping that for your body a threshold level, upper the second dose will create the.
Mhm.
Okay.
Okay. Why? Okay, I think you already answered. Why pregnant ladies are not given vaccine? Because the government hasn't approved, but it's recommended, right?
Yes.
Uh, what should we do for parasomnia due to COVID?
Same thing what I said. First thing, it will come back by itself in 14, 15 days. But isolate yourself, talk to the physician, take your supplements, keep watching for the detrimental signs.
Yeah, I think
Okay.
the person is going through treatment endometriosis, they can still take the vaccine. Yeah, nothing, it's not going to interfere.
That thing.
The only thing is, like in pregnancy sometimes, and sometimes people take two vaccines. So, how long should they keep the gap?
2 weeks is the gap between two different vaccines, whether it is HPV vaccine or Tdap or flu vaccine. And this 2 weeks is the gap which we recommend.
Yeah. Okay. Thank you so much. Thank you. Bye. Bye.
Take care.
Well, this brings me to the end of this video. Thank you for watching. If you like the video, subscribe to my YouTube channel, Quick Mommy Hacks, and follow me on Instagram